So we're going to start with the heart. The heart has 3 layers. The outermost layer is called the visceral pericardium or the epicardium, but it's not shown on this model. Then we have the myocardium, which is like the muscular layer, and we have the endocardium, which is the innermost layer of the heart. On the right side, well, on both sides, we have the right and the left auricle, right and left auricle. So on this side really fast, we have the trabeculae carneae, and we have the pulmonary semilunar valve, which is this right here. Then for the inside, we have the opening of the superior vena cava and the opening of the inferior vena cava on the right side. We have the tricuspid valve, or the right atrioventricular valve. We have the chordae tendineae, which is on the bottom. We have 3, which is why it's called tricuspid, and the papillary muscle, which is located on the bottom of the valve and opens and closes the valve. Right here, it's not shown on the model, but we would have the opening to the coronary sinus and the fossa ovalis. Then on the left side, we have the bicuspid valve, or the mitral valve, or the left atrioventricular valve. We have the pulmonary veins, which are these little dots here, the aortic semilunar valve, which is located at the bottom of the aorta. And separating the left and the right side, we have the intraatrial septum and the intraventricular septum, which is down here, which separates the atrium, and the 2 ventricles. And yeah, that's it. Now we're gonna do the arteries, which I'll do on the larger model. On this side, so here are the right and the left auricles. We have the right coronary artery, which splits to the marginal artery and the posterior descending artery. We have the left coronary artery, which becomes the left anterior descending artery, which is this artery here, and the circumflex, which wraps around the heart. And then in the back, we can see the posterior descending. And then, which I'll show on the model better, but we have the ascending aorta. This would be right here, the brachiocephalic, the left common carotid, and the left subclavian. So as I was saying, this is the ascending aorta. This would be the brachiocephalic, the left common carotid, and the left subclavian. The left subclavian turns into the axillary artery, which is on this side here, we can see. And here, the brachiocephalic breaks into the right common carotid and the right subclavian. The right subclavian again turns into the axillary artery, the brachial artery, which keeps coming down, and then we have the radial artery and the ulnar artery. On this side, the left common carotid has an internal and an external. The internal isn't shown, but the external common carotid would be right here. This would be the thoracic aorta, which isn't shown, the abdominal aorta, which is down here a little lower, the celiac trunk, the superior mesenteric aorta, the gonadal arteries, which isn't shown. Right here we have the renal arteries, which go into the kidneys, and the inferior mesenteric artery. So here we have the iliac arteries. We have the internal iliac artery and the external iliac arteries. They're seen on both sides. We have the femoral artery, which we see wraps around, except down here it becomes the posterior tibial artery, and the medial plantar artery. The lateral isn't shown, but the medial plantar artery curves around. Here we see the anterior tibial artery and the duralis pedis arteries. So this is the brain. This is the cerebrum, which is the top, the longitudinal fissure, which separates the right and the left hemispheres. This would be the right, this would be the left. And then we have the lateral sulcus. We have the precentral gyrus, the postcentral gyrus, and the central sulcus, which splits the post and the precentral gyrus. We have the lobes. We have the frontal lobe, which has the frontal bulb and has the olfactory bulbs, which is the first cranial nerve. We have the parietal lobes, we have the temporal lobes, and we have the occipital lobe, which is in the back. And that is it for this. So this is the insula. Here we see a better view of the, this would be the front, of the precentral and the postcentral gyrus with the central sulcus dividing it, and again, the olfactory bulb. This would be the lateral ventricle, which is the space there. This is the lateral ventricle. This is the corpus callosum up here and the pineal body. And then so this piece would go in there. This right here is the choroid plexus, which would like go up here. This is the intermediate mass, the thalamus. We have the hypothalamus, which could be seen here. Okay, this is better. This is the choroid plexus, the thalamus, the fourth ventricle, the pineal body. Here we would have the hypothalamus. The hypothalamus would extend, like there would be like a little thing there, which would be the infundibulum, and the pituitary gland, which isn't shown on this model. Here we have the pons. So this whole head is the diencephalon. The neck is a mesencephalon. This would be the pons, and this is the medulla oblongata. Yes, so here we would have the cerebroaqueduct, which would lead to the third ventricle, which would be down here. And the third ventricle would lead to the central canal. And that is it. It would be the corpora quadrigemina, and the peduncles would be here, which is shown better in the cerebellum. This would be the arbor vitae. The peduncles would be here, cerebropeduncles, and these are the cerebellum. Cranial nerves. So as we said, we have the first cranial nerve, which is the olfactory. Let me see which one shows it the best. This one, I guess. This would be the optic nerve and the oculomotor. So it's like 1, 2, 3. Then we have the trochlear, the trigeminal, which like curve around. We have the fighting vicious abducens, the facial. Let me do it on this one. Okay, as I said, the olfactory, which is cranial nerve 1, is found here in the frontal lobe, frontal bulb. And then so on top of each other, we have, so olfactory, we have optic, and we have oculomotor. Then we have the trochlear and the trigeminal. We have the abducens, the facial, and the vestibulocochlear. Then we have the glossopharyngeal, the vagus nerve, the accessory nerve, and then the cranial nerve 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. I hope that was correct.